interest of time, but also I think because this session is made up of talks that are closely related to each other, I think it might make sense to keep some of the questions to the end. Catherine Littler is now going to talk about, from a funder's perspective, and focusing on CHIM studies in particular, what the role of what it means to be a responsible funder.
Okay, just checking everyone's still with us, because the room's gone from being freezing cold to being warm. So put your hand up if you're awake. You're lucky we're not at one of our public engagement meetings, because I'd get you to do some sort of dance now, but I'm not going to. You'll also be relieved to hear that I'm not going to speak for too long. What I want to do is frame our thinking. And this is a work in progress, so it's important to say this. And this is very much a welcome perspective, but I think it's important to consult with other funders on this topic, and I will talk about that shortly. So, why are we interested in CHIMs? I need to frame this because our future CHIMs funding is very different to what we funded in the past, in the sense that Wellcome is traditionally a response mode funder. So that means someone like you with a brilliant idea comes to us, knocks on our door, we say, great idea, we'll fund you. Our funding for where CHIMs fits is very different. We now still have all our response funding, but we also have what we call priority areas. They are around issues such as antimicrobial resistance, they are around looking at research capacity in Africa and Asia, and we have one on vaccines. And CHIMs fits in this vaccine model. So we have identified CHIMs studies as something we want to focus on over the next 5 to 10 years. There are 4 focus areas within our vaccine strategy, and CHIMs fits in innovation in vaccine development. You will see it's basically through the expanded use of controlled human infection models to accelerate vaccine design and development for target populations. So we've got quite a decent budget to spend on this and quite a lot of strategic thinking to be done to work out how to do it. I think if you're going to do something like this, I'm not going to focus on this, I think you really do need to have a strong rationale and scientific justification for it. So strategically, why have we chosen this? We want to speed up the development of vaccines where ethically acceptable and possible. It takes around 20 years to deliver a new vaccine. And I think CHIMs can help with speeding up that process if it's done well in endemic settings. And that's the discussion on the table as far as we're concerned. How do you do it in a socially and ethically acceptable manner? So thinking about speeding up that process, I think Nick's already alluded to why are we thinking about supporting CHIM studies in endemic areas, as opposed to, I think, over 93% of current CHIM models are in northern countries. Very few conducted at the moment, and I think, as Rika has just pointed out, very little guidance on how to do it. One framework from a meeting that we had in Blantyre in Malawi earlier in the year. I think there are some earlier frameworks and writings. Christine Grady's 2001 document, I think, was one of the first one in this space, but most have not focused on LMC at all. So what's our approach at Wellcome to doing this? So I think there are ethical things that we need to address. There are also massive practical issues with funding this type of research in a low and middle income country setting. If you're going to fund something that you know, for example, I think Dorcas told us with the KEMRI example, the CHIM model at KEMRI on malaria, you can't afford to put an additional burden on an already stretched health resource setting. So our choice is to go forward with funding in areas where we have strong infrastructure and support. So we're going to work with our overseas programs. There's one here in Bangkok, there's one in Vietnam, there's one in Malawi, South Africa, and Kenya. Because we've funded in these places for long periods of time and they have the necessary infrastructure to be able to support these types of studies. And I think that is a critically important point if you're going to move this into an endemic setting. We also intending to support this in a holistic and coordinated manner, and I'll talk a bit more about that in a moment, what that means and how that feeds into being a responsible research funder. So I think if I gave this talk in 2 months, 6 months, 12 months, you wouldn't have 3 overlapping circles. You might have 6 or 9. 9's probably too many. It gets too confusing. We don't want to confuse you. But we would have more. The reason I said a starting point is because we are very early days in our thinking. So the first thing we are doing at the moment is doing an evidence review of the previous CHIM studies that have been conducted in low and middle-income country settings. So we've already had at least 2 mentioned today. We've had the one in Thailand, we've had the one in Kenya, there's one in Tanzania, I think Gabon, and 3 or 4 others. So we put out a call, and that is being researched at the moment. What we intend on doing with the evidence that we gather from that is to feed that into future guidance. So what we want to do in that call, and people are being interviewed as well as grey literature and a full literature review with that review of previous CHIMs, is to ascertain what worked and what didn't. Ethically, what was acceptable in those particular contextual settings, what kind of governance did they need to have in place, what kind of regulation is there, and going forward on the back of that review, what kind of governance, ethics review and regulation do we need to put in place to make it acceptable in these settings, and feed that into a larger ethics framework that should be developed by people from this community and not us. I think the funders' principles are a slightly different thing that should be developed by us, but it should sit alongside broader ethical guidance. We are also looking at community engagement. Community engagement, as I think Dorcas really well illustrated this morning, has to be a key feature of any kind of CHIM study. But not in terms of just getting the consent. It has to be part of the research design process from day one. And that includes doing what we did in Blantyre. Before you even start research, you bring together regulators, you bring together your local and your national research ethics committees. You also bring together policymakers, researchers, if you can, community members, to start discussing what a CHIM study should look like if it is acceptable in that environment. So those kinds of pre-conversations, I think, are critical and will be fed into our funding mechanism. I think the other thing we are going to learn from that review is how to fund. So we can fund in terms of giving extra money for the ethics. We can think how to bring up regulatory systems, and that might be working with other organisations such as WHO, who have more of a legitimacy in this space. It might be working with regional regulators, regional ethics committees to address some of these issues. But I think the critical point that came out of the Blantyre Malawi meeting is that the study need to be driven by local needs and local clinicians. So the PIs of these studies will also need to be those people that are embedded in those units in those countries. I think especially it's been raised in a number of the questions earlier about building confidence and trust in these systems. You can only build that if you have done the engagement before. And I think you have to pre-consider some of the issues that could potentially go wrong and how you're going to deal with them. So, funders' principles. Why are we doing funders' principles? How does this sit alongside other mechanisms? Well, the first answers, I think, you could substitute the word innovation and put research in there. So I think we have an obligation as funders to support research that sustains the public good. I think CHIM studies, as we have already alluded to, raise unique ethical concerns. I think this places a greater responsibility on us as funders to consider how to address these and work on our research design model with our research community. I think also we've started looking at principles as a model for how we fund in issues in areas that are either new, emerging, or have very big ethical issues. So we're currently in the process of developing some for gene drives. We've done some in the relation of data sharing and public health emergencies. And we've also looked at doing those in areas around access to medicines where you have controversial issues and little agreement. The benefit of doing principles is that we can work with other funders to get consensus. That will make it easier when you are funded to do research because you'll get a harmonisation across a multitude of funders, and we will get the key funders involved in these discussions. It also sets the bar really high for this type of research. So if you're not adhering to the funders' principles, countries, organisations can answer why. You will be the person who's the outlier. So I think there's an impediment and an imperative for us to really create high standards of research. And funders and principals have the capacity to do that. They also give us something to leverage implementation on. I'll acknowledge the challenge of principles. It's quite similar to some of the challenges that people have acknowledged about implementation. And also, if we just keep delivering multiple principles across different types of research without actually considering how they're harmonised, it'll be death by principles because it'll be too many for the research community and you'll get confused. So it's really important that when we do this kind of principle approach, we look to harmonise across different types of research areas. I think anything we have to do has to be complementary to other international and local guidance. Rico mentioned both the Malawi framework and the WHO guidance, and they are developed very differently with a different kind of legitimacy to us. So I think it's important that anything we do fits in with theirs. I think one of the really key things about funder principles is also, this came up at the very beginning of the meeting in Glenda's talk, when she talked about, for various reasons, whether they be lack of funds, lots of guidance aren't actually adhered to in country. Funders have the ability to make researchers adhere to guidance. We can make them implementable by doing it on different levels. One, we can build it into our policies that are required as part of your grant funding. Two, we can make it so that you're given additional funding to do the things that are covered by the principles. So I think there is a very important role for us to be able to play in implementing and making sure the research that we fund is adhered to. I think the critical thing about implementation is, from experience, it's one thing to have a policy, it's two to work out how to implement it. So what we're learning with the Gene Drive work, which they will be published very soon, is we've set up funder working groups to go through the different areas and to work out how we're going to implement them across our policies and how we can work with the community. So just in terms of where we are in the process, we're going to bring funders together in February 2018 to get sign-off on these principles, and we'll bring them back to this group. But I think what's critical is these kind of conversations, because anything that comes out of this meeting will be fed into our principles and wider ethical frameworks that we're planning to support. But it is my last.